very much for joining our July information exchange meeting. It's on foot health, and I know this is a very important topic for most of you. We have two great speakers today, Chubby Brody who is the head of podiatric medicine at Homerton Hospital, and Jackie Brett from Hoxton Health. They will both introduce themselves and we'll talk about foot health, what services are available, how you can access the services, what is the waiting time, and other useful information. I will then now hand over to Choba. Sorry, apologize.
Okay, can you hear me?
Yes, we can.
Thank you for inviting me to your meeting. It's a pleasure. So my name's Choba. I'm a podiatrist as well, so I'm just not the manager of the service, and I'm clinical for 50% of my time. So I'm part of the podiatric medicine and surgery service, so that's two sections. We also have footwear within our remit, so we provide surgical footwear as well, my team. So I thought I'd talk just a bit about what a podiatrist is. So podiatry training, so podiatry study the structure and function of the whole body, and we specialize in the foot and ankle and lower limb. So it takes 3 years to do your basic degree course, and the nearest one is at University of East London. And then when you want to specialize in, say, diabetes, children, musculoskeletal, it takes probably another 10 years of training and specialization for that. So we have a specialist in most of these fields. So it's quite a long training to become an expert, like everything. So what do we provide in City and Hackney? So we treat foot pain. So we diagnose and assess people's foot pain by looking at the structure of the foot, maybe looking the way you walk, and things like that. So that's called the musculoskeletal aspect of the service. And we might then prescribe orthotics or insoles to help people walk and relieve their pain. So we do that for adults and we do that for children as well. So we do see every age group. So we're not specialists just in one age group. The most important part of our service is we treat high-risk feet. So what I mean by high risk, it's people who have diabetes, who have a complication in their lower limb. Just having diabetes doesn't make your foot at risk. You usually have a complication such as poor circulation, or your feet go numb, or there's a few other things that we see for diabetes. Also, people with very poor circulation, so not much blood getting to the lower limb. So vascular disease, that's another high risk group that we'd want to see, because you could lose your legs or toes with these kind of conditions. So that's a priority for the service. And we have a lot of people in Hackney, patients and residents, who have these complications. There are other high risk groups, some people with rheumatoid arthritis or people on specific medications, steroids, etc., that could put their foot at risk. So there's lots of additional ones, but they're the main ones. And so that's the bulk of our work within the City in Hackney. We also do toenail surgery. So people with ingrown toenails or very thick nails that are difficult to cut, especially the big toenail, we can remove them from an operation under a local anaesthetic. So we do quite a lot of surgery within the community. And that's, again, all age groups, as long as you are fit and healthy to do that. So we also treat skin and nail conditions, again, only for the high risk group of patients. So the group that I've just discussed, that's the kind of patients that would come in to have some kind of routine care done to prevent them developing problems that could lead to infection and amputation. Linked to our services, we have a foot surgery service. So podiatrists have gone on to train to be podiatric surgeons. So we're not doctors, we're allied health professions. We're allowed to operate on the foot with training, prescribe drugs, etc. Send people for x-rays, MRIs, ultrasounds. So we can diagnose everything in the foot generally. So we would, if you wanted surgery, say for your bunion or your hammered toe, normally you'd come into our service and we would assess you, help you with shoes, etc. If it doesn't work and you want surgery, we refer you on to the surgeons within our service who would then assess you. And again, that's based at the Homerton Hospital, where our service is generally based within the community. So we have many sites. We have the St Leonard's big site, where most of our specialists work. We have John Scott Health Centre, Kenworthy Road, the Neiman practice in the City of London, and then we do a homeless clinic at the Greenhouse, and then we do outpatients at the Homerton Hospital, and we do some inpatient work at the Homerton Hospital as well. So quite a big service, and we do some home visits for those people who cannot get out for any other reason. So it's a very limited home visiting service. That's the kind of things we do provide, generalising. What we don't provide, and what we're not commissioned by the GPs and the CCG in Hackney, so we don't do basic foot care. So that's nail cutting, unless you are high risk, which we've discussed. Callus and corn treatments, again, we don't provide that. And verruca treatments, so no one really provides verruca treatments. Even the dermatologists don't provide verruca treatments anymore. There's poor evidence that any treatment works. We give you more pain, we break the skin down, and most verrucas go within a certain period of time. So they're the kind of things we don't provide. We don't provide care if you do not live in Hackney or have a City and Hackney GP. So we're only commissioned for the local population. And all that information is on our website. And if you want information on how to care for your feet, there's lovely videos about nail cutting, footwear, various stretching that we might ask you to do on the Homerton web page. We made some videos which are accessible. I'm sure HealthWatch can do a hyperlink if need be to that. But how do you get to see us? So we're an open service, but most people get referred by their GP, because the GP is probably the best person to see first, to look at your foot and see whether a referral will be appropriate to podiatry. Maybe a physio needs to see you with a certain problem, and they refer electronically. So the GP refers in electronically to us. We read them Monday to Friday, and we either accept or reject. Once we accept them, the clinical assessment service at the Homerton sends you a letter or rings you to book you an appointment into the appropriate clinic. So that's how the system works. That's for non-urgent. You can also self-refer through the Homerton website. Again, if you go to the website to podiatry, there is a self-referral form that you can fill in and click yourself, and that's monitored as well. So that's open to anybody to fill in. Obviously, you need to meet the criteria to access the service. If it's something that we don't offer, you'll be telephoned to explain why we don't offer that service, or where you should go if it's the wrong service. And remember, you need to live in City and Hackney or have a GP. A lot of people fill them in and they don't live in the borough, and we're not commissioned to do that. You need to go to your local service. We have an emergency clinic. So these are for very serious foot problems. It used to be a walk-in clinic, but due to COVID and the restrictions, we would ask patients to call the service or email the service. The telephone numbers are on the website and the emails on the website, to book us, to email what the problem is or telephone us. And then if we feel it's an emergency, we can book you a slot that morning, so that we don't have lots and lots of people turning up at the same time. So we will still see you, but we'll give you an allocated slot so we don't fill up our waiting room. We're only allowed so many people as everywhere in a waiting room. And the clinic is it's from 9 till 10, Monday to Friday. So things that we would want to see is diabetic who have a foot ulcer, so an open wound on your foot, or someone with poor circulation, peripheral artery disease, again with a open wound on their foot, or maybe a red, hot, swollen foot. You think you've got an infection in your foot that's spreading. If you fracture your toe or your foot or a foreign body, you get something in your toe or your foot, they're the kind of things that we would see on the emergency. We wouldn't see an ingrowing toenail unless you were diabetic, because that might need surgery and you need an assessment for that. So that we wouldn't see that. So it's for things that you may lose your leg or have serious bacterial infections. So fungal nails would not be a criteria. I know some people turn up with that. So that's for the very urgent. And we would encourage you to call up or email with that. If you can't, then you can turn up, but you may have to wait for a slot in the morning before we let you into the building. Okay. We don't have any long waits at the moment. We usually see people within 5 weeks, which is our target for non-urgent, but it's not that long at the moment. We're about 99% offering appointments within 5 weeks. That may change because we've got 3 members of staff at the moment who've actually caught COVID, and they are off isolating for 10 days. So bear with us. We, like everyone else, have to isolate, and that puts a big strain on the service when you're not here for 10 days. You may have to have your appointment cancelled if we cannot cover it due to the people being off isolating. And this time of year we have annual leave on top, so we've been asked to take 50% of our annual leave by September this year, in preparedness for the winter months where obviously flu and COVID may be a problem. So we do apologise if you have to have your appointment cancelled. We don't want to cancel. We try every way to put you somewhere else, but unfortunately we may not be able to do that. So the waits are pretty low at the moment for the non-urgent. Our referral rate's been lower. It's starting to go back to normal. Last month it was about 570 referrals. We were working about 600 to 700 before COVID. It dropped to about 100. But it's gradually picked up. I think people are seeing their GPs now, etc. So we're getting towards our capacity again. A few tips for looking after your feet. Obviously, daily washing of your feet is very important. You've got a lot of bacteria in your feet, and that prevents infections. That gives you an opportunity to look at your feet, make sure there's nothing wrong. Wear natural products on your feet, socks and shoes. Wear good supportive footwear. That helps joint pain, arthritic feet. So things with laces, cushioning soles, nice and wide and deep. Cream your feet if you've got dry skin every day with any good moisturizer, that's good. If you cut your nails, follow the shape of your nail, a bit like cutting your fingernail, and there's a video online to show you how to do that. And that's basically some tips just to look after your feet. In the hot weather, let your feet air. You can put surgical spirit in between your toes to make sure they're nice and dry, so you don't get fungal infections, but don't put that on any other part of the foot. So that's briefly what I really wanted to say. So a snapshot of the service. Probably we've got about 20 something podiatrists. We've maybe 23, it varies. We've got some vacancies at the moment. We're trying to recruit, it's not been easy. So we have a vacancy rate of about 2 podiatrists. We've got 3 assistant podiatrists that help us in clinics to do various tests. We've got 4 administrations to help with booking appointments, booking transport. Unfortunately, we've only got 1 at the moment. 1's on maternity leave and 2 have left. So we're recruiting at the moment. So we are very short-staffed for our admin team. But to book an appointment, you should call the clinical assessment service, not the department. They're the people to book appointments. If you book us, you'll find it difficult to get through with the number of staff we have, and then we'll just redirect you back to the clinical assessment service, because that's a centrally service based at the Homerton Hospital who book all appointments for services, and they know how to do that, and they're staffed to cope with the demand, and they have a waiting system on their phones, so you know you're getting through. So I would plead that people please call that rather than the service, because you may get frustrated to try and get through, and it leaves the line open for people who want to call us with urgent problems and queries about various conditions. So hopefully that's a bit helpful. Obviously, I'm happy to answer any questions if I haven't covered anything. And thank you very much.
Thank you very much, Robert. That was very, very useful, especially the tips on how to look after our feet. Absolutely. If there are no urgent questions for Choba, I'll give the word to Jackie now. And after her presentation, you can raise your hand or you can put your questions in the chat box and we will get them through. Thank you. Jackie, over to you now.
Okay, thank you. Thanks, Canaria. So I'm Jackie and I'm working at Hoxton Health. Hoxton Health is an independent charity, so not part of the NHS. And we have been operating since 1987, so I believe it will be 35 next year. And we were set up to make access to non-NHS therapies affordable to local older people and to people with long-term health conditions. So I know we want to talk about foot health, but I'm also going to mention that we provide low-cost and subsidised acupuncture, massage, aromatherapy massage, craniosacral therapy, manual lymphatic drainage, Indian head massage, homeopathy, osteopathy, reflexology, and something called Mazier's method, postural re-education. So we've got a range of things that we offer, and they're mainly to help people with pain, mobility, anxiety. and the prices are subsidised, particularly for over 70s, but also for 60 to 70s. So we been offering foot health, as far as I can work out. I'm quite new in post, but we've been offering foot health for a long time. We've had a clinic in St Leonard's, and it's aimed at people that aren't eligible for NHS treatment. And we've also run homeless clinics for people who are homeless as well. Our foot clinic is toenail cutting, essentially, and hard skin removal in terms of filing down hard skin. But we can't really deal with corns in St Leonard's. We do have one clinic that can, and I'm thinking about whether we need to put on more. We do charge. We charge £15 per appointment, and we also charge an initial £8.50 for people to buy a foot kit when they first come in, which I can show you in a minute. I didn't bring one with me. Since COVID, we used some of the COVID response grant to provide home visits to people, and this was then picked up by the CCG as a temporary thing. So we've been able to provide home visits to people that can't get into clinic, and we've also had a surgery at Nightingale Hospital at a weekend. But I've just heard today that the CCG are going to are not going to renew that grant. Now, obviously, I will be appealing that or putting in a business case, because it means we won't be able to offer any home visits. And we will continue to try and offer the clinic, but sorry, at the moment you can be referred by a GP for free if you're on benefits, but obviously we won't be able to do that if we don't get the CCG funding. But also the whole thing is quite difficult, because we do have some DNAs as well, which obviously if that also costs us quite a lot of money, so I will definitely be going back to the CCG. But anyway, so at the moment we have maybe four-week waiting list, 4 to 6. I just put on some extra clinics because we are getting so much demand, and obviously it's repeat demand. You don't get your toenails cut once, you need them done regularly. So we're getting a lot of new people every month, maybe 30 new people that need toenail cutting, and therefore we're putting on extra clinics. And so far we've still got capacity to do that. I'm listening to Shabba and the recruitment problems with interest, because at the moment we've still got some space, but that obviously we might reach the end of that. But we also do only have 2 rooms at St Leonard's, so we can't do toenails all week. It's not what we're here to do. So there will be some stoppage there in terms of how much we can provide at St Leonard's, just in terms of room availability. So that's it really. It's the waiting times, yeah, like I say, are 4 to 6, and we've still got capacity at the moment to put on additional clinics. We've just been funded by the Corporation of London, so we got a clinic in the city, and we can continue doing home visits in the city no matter what, but Hackney is slightly different at the moment. Okay, that's it. Thank you.
Thank you very much, Jackie. That's really useful information as well. Any questions to Choba or Jackie at the moment? I drafted a few for myself. Yes, Mr. Gledhill, yes.
Right, well, basically, when you mentioned there is a clinic for corns, is that with Hoxton Health or is that with St Leonard's?
Jackie, I think that's for you.
Yes, it is. Yes, so at the moment we have, so the people that work in Hoxton Health are not fully qualified podiatrists. They are foot health practitioners, so they're fully qualified to cut nails, etc. But they don't deal with corns. We do have one fully qualified podiatrist that is working once a month clinic at Nightingale. So it's not in St Leonard's, but that's one of the ones we'll have to stop with the funding when the funding runs out.
That's a shame, because people like myself not only want nails cutting, they want a few corns removed. My local chiropodist charges £35, which is an awful lot of money. But I'm amazed that we haven't got anything laid on for pensioners.
Yeah, I mean, if I can find a free venue, it may be something we can do, and we're going to be fundraising as well to try and subsidise this. So, yeah, I mean, I'm just giving you the truth at the moment of
Yeah,
the
sure,
picture.
sure,
Yeah.
pleasure.
Yeah.
Yeah, I must admit, I did go to St Leonard's to have them done, and I was told rather unceremoniously that it would be a one only. And
Yeah.
so I went home and I thought, well, hard luck, and that was it. But as I say, I regularly go about every 6 weeks, and £35 is an awful lot of money for 10 minutes work.
Yeah.
Thank you, Mr. Gladhill. Jackie, before we take another question, just to clarify, you mentioned about room availability, that you don't have, you can't provide toenail cutting at St. Leonard's Hospital because you don't have a venue. Is that what you said?
No, so we've only got 2 rooms, and obviously toenail cutting's not our only business. So so that would be the limit that would stop. So we're putting on extra surgeries at the moment. We do all day Thursdays. We're doing every other Wednesday, and we do some Fridays. But we also want to make sure people can access the other therapies we offer.
Right,
So,
and you are only based at St. Leonard's Hospital and nowhere else.
So we run a foot health clinic at Nightingale Practice once a month at the moment on a Saturday. And we've got one at Neiman Practice, which is currently once a month, but we'll probably build that up if there's demand, because we got the funding from the city to enable us to do that.
Right. Okay, excellent. Thank you. Thank you, Jackie. Any other questions for the speakers? I can't see any hands raising. That's fine. Then I'll go with my with a question for both of you, actually, in terms of people accessing your services, whether it's for a surgery or getting the affordable toenail cutting, for example, and considering the population in Hackney and their ethnicity background, not all of them have English as their first language. What are the interpreting services that do you provide interpreting services for those who have limited or no English? Chaba?
Well, obviously, because I work from the Homerton Hospital, there is an advocacy service that we can access, and there's a telephone helpline. Going back to the toenail cutting, I'm not sure you still run Fountain Road Clinic. Is that stopped?
It never started. They wouldn't. John, the guy, there was an issue with the premises and paying rent, and yeah.
Oh, really? That's terrible.
Yeah.
I'm really sorry, because that shouldn't have. Yeah. All right. I'm sorry.
No.
That's something to bring up. There is a spare room there that we don't use, and there's a couch, and maybe the CCG can help with that. That's terrible.
Yeah.
All right. Sorry about that.
No,
that's something that perhaps can be taken up after the meeting, I guess. Which
No,
a very useful. No, I think it's really good, and if there is an opportunity for you to get this, that will be really beneficial for Hackney residents. So, Chaba, you were saying that you use the interpreting services available at Homerton Hospital.
Yeah.
And does that increase the waiting time? Because we know that you know, some surgeries are also using these services. We appreciate that there are not many.
So we get an allocated lump of money or a spend a month. So once we spend it, because there's only a limited amount of money for advocacy, once we spend it, we have to wait till next month. Depending on the language availability, it could be a slight delay. So it varies from month to month on how many people are referred in. A lot of times we have bilingual podiatrists, so that does help. If relatives come along, that does help as well. Or we can use a telephone, but that's it's not straightforward on telephone. But we do our best. So it's not a huge rate, but it depends on the month.
Right. Okay. Thank you. And with the self-referral, Chaba, you also mentioned, sorry, Jackie, I'll come back to you on the interpreting, I apologize. On the self-referral, you said that people can actually self-refer themselves by completing the online application form. Is there an acknowledgement of once they submit this, or?
You will get an email to say we've received it, so you know it's gone through, and it'll remind you what we accept or not accept, but you get an email. They're read Monday to Friday, so you should get a call usually within 5 days, or depending on the week. We don't get loads of self-referrals, to be honest. It's usually the GP or a nurse or another professional refers us. But you get an email. If you've done it correctly, you'll get a response saying, thank you for your referral, and tells you what happens, and then we'll contact you.
Excellent. Thank you. And Jackie, if I come back to you now on the interpreting services.
Yes, sure. So we don't have access, and at the moment we don't have many volunteers. We've only got one, so we're in the process of recruiting more volunteers, and obviously we would welcome bilingual volunteers. So to date we've been working through, it's been relatives and neighbours actually that have been phoning up on behalf of people. Many of the people we work with are quite elderly and frail, so it often is carers that make the initial contact in terms of self-referral as well.
Okay, thank you very much. And you also, Jackie, mentioned about the funding from the CCG, that it's about to finish soon.
Yeah.
But until then, until it's still going on, people can access the services for free.
So if you are on pension credit, yes, but in that case we do need the GP or a social prescriber or to refer, because we're a very small staff team and we're not means testing people. So we just need a paper trail. We can show the CCG basically that people can't afford it.
And when is that funding about to end, if we may ask?
Hello, can you hear me? I'm on the phone.
Yes, we can hear you. If you just give us 2 seconds and I'll give the word to you to ask your question.
Yeah.
Thank you.
It's due to end in September, so I'm going to be putting together a business case in the next couple of weeks to take to the CCG, because I mean we're going out to a lot of people who are housebound, so I'm not quite sure what would happen if we're not providing the service. So yeah.
Excellent. Thank you, Jackie. Yes, the number ending. Yes, hi, we're listening to you now.
My name's Vivian. I'm in Clapton Park. I go to Kenworthy Road, so I don't know if there's a bit more space available than in these other overloaded places. I used to go to a paying clinic in Leighton. I thought maybe I found it quite difficult to fit with the appointments, but it's been better than I expected. And they're getting a little bit closer together, which is nice. I'm going about every 6 to 8 weeks, and having various things attended to, and it's a quite relaxing place, very orderly environment. I just thought you might like to know that. And I've now got an appointment for looking at shoes, footwear, soon from them.
Right. Hopefully that appointment will go well, and thank you very much for sharing this information, Vivian.
Yeah.
Thank you. Any questions?
Oh, by the way, the other thing I wanted to know, which languages are needed for the interpreting for volunteers?
Jackie, I think that's for you.
Oh, sorry, I was on mute. Well, Turkish
languages. Turkish, right?
It would be one of them.
Yeah.
But maybe some Eastern European languages would be useful. And some African languages. Right. So French for the francophone, but yeah, but we want volunteers.
I can provide French if you wish for the francophone. That's about it. That's about this.
Well, at the end, we will send you all the information that was shared today with the useful videos that Joba was talking about, contact details for Hoxton Health. So you'll have the opportunity to get in touch with them if needed, and explore opportunities as well. And we'll make, I'll happily send this request to our volunteers as well, Jackie, because they most of them speak second language as well, and I'm sure they'll be able to help if needed.
Thank you. Thanks.
Thank you. Any other questions? No questions? So probably your presentations were very explicit, I guess. Thank you very much. I think I've got another question. So, Choba, very recently we heard from a resident. Let me just, yes, very recently we heard from a resident who had issues, had a big lump on her feet, and that was changing shape and color. And her GP was trying to refer her to send to your services at St. Anne's Hospital. But the GP was actually told that the person doesn't meet the criteria to be referred to the services as an emergency, because, and when they were asked what the criteria are, and they were told the person either needs to be diabetic or the leg needs to be amputated, which was a bit worrying to hear. Obviously, that's the one side of the story. But would you have any comment on that? I mean, I know you mentioned about the emergency, access to emergency services and what is classified as an emergency. And I remember you saying that it's not enough only for you to be diabetic, but there are other criteria as well. If you can a bit more explore on that.
Yeah, I do know this case, and it was a complaint, and it has been, the final response is gone. But I can tell you that it was during the first lockdown when all services were asked to close by the NHS, and there was very specific clinics that you could open. So it was at the first wave, the first lockdown, March 23, a year ago, and we could only see very, very few cases. And this case actually was ended up as a surgical case, and ultimately should have probably been referred to surgeons. It was beyond actually what we could do, but it's been dealt with, hopefully. And so it was in a different context, that it was in a very unusual condition that we weren't allowed anyone in the building. I don't know if you remember, it was like you couldn't even go to the supermarkets, you had to queue. A&E, no one went, everything was shut down, all outpatients were closed. And that was the advice from the NHS. So they didn't fit the criteria at the beginning of the first wave, but as we opened up in May, June, we could see more people during that time. The criteria changed. So my sort of college, the Royal College of Podiatry, in June last year produced a green, amber, red, who we could see on those criteria, and that was published in June last year, and we were working to that. But now we're fully open and we will see everybody. But yeah, it was an unusual time of the year, so
yes, I guess so. Thank you very much again.
That's no problem.
Any further questions for Choba or Jackie? No? Okay. Well, that's quite interesting topic, really, and I was hoping that maybe questions will come after the meeting, which is absolutely fine. And I hope you don't mind if I send you any outstanding questions after the meeting. Is there anything else that you would like to add to your presentations? Jackie?
Please raise the volume.
Oh, you should raise the volume from your side, I'm afraid. Can you do that? Yes, I'm not sure if you're joining on your tablet or your laptop. Yeah, we've lost the person. That's fine. Yes, Choba, any final words perhaps? Because yeah, I don't see any hands raising at the moment.
Not really. I mean, if anyone, the GPs can always call. We have a duty podiatrist every day, so if there's any difficulties or confusions with referrals, the GPs do know. We've had one, so there's a duty podiatrist every day that a GP or health professional can talk to, and we can try and solve any problems initially, see what's happened to a referral, why someone hasn't been seen, or a query, or whether they should come to the emergency. They can talk to the duty podiatrist. We work quite closely with Hoxton Health. We try and support them as much as we can. And obviously if there's a patient they feel that we need to see, they can just refer them down or ring up and speak to us. So and we're very glad we have Hoxton Health. And it is the trouble with it is that toenail cutting is a social care issue. self-care, social care, and it gets a bit confusing. Who should fund it? So any pressure to the council will be great. So the City of London have funded Hoxton Health, but we are one service for both patients of Hackney and the City, but the City of London have more finance. It'd be a shame if we can't use the Neiman practice for residents of Hackney, because we do have a clinic, they're an NHS clinic, and anyone can go to that clinic, but I'm not sure what Hoxton Health's criteria is, only city residents, which there may not be a lot of, to be honest. So maybe joined up approach from the councils about providing social toenail cutting would be very helpful. Maybe Healthwatch could support us in that endeavour.
Yes, of course, we can definitely talk about it further.
Yeah.
Absolutely. Thank you.
Because it is a very important issue for most
Absolutely
older people. We're not, as podiatrists, saying it's not important, it's just not what we do, but we do recognise it is a very important part of what it is needed in some form. Very few places offer it, usually Age UK and other boroughs. I don't think Tower Hamlets offer it at all anywhere. Islington, not sure they do, but very few places offer it. So Hackney have got at least something, which is good, but it's not enough, and it needs to be, we need to push the social service side and support Hoxton Health.
Absolutely. Really. Thank you very much, Abba. And again, we'll be definitely in touch with you both on this to see how we can really help improve the health and well-being of Hackney residents with the about toenail cutting, etc.
Because I was just going to say, I've been talking to Healthwatch City of London about this as well, so it might be worth working with.
Absolutely good
There's
idea.
two health watchers, and they kind of come from different angles. So maybe this has been a topic that Healthwatch in the city have been raised and concerned about. So it'd be, maybe if you talk to your colleagues at Paul, then they might be able to do some joint funding.
Absolutely.
How they got funding for people in Hackney, because Hackney residents are much more poorer and vulnerable and much more social, have different health problems, and I think they might be left out of the whole process, to be honest.
Yes, I think you have a point, and yeah, we've done quite a lot of work jointly with our colleagues in the city, so definitely that's something we can explore together again. Absolutely.
Thank you.
Thank you. And Jackie?
Yeah, no, thanks, Shaba. I mean, I think there needs to be a strategy for people that can't get out the house, older people, because if we can't do it, I'm not sure no one else can. And either you're training up care workers to do it, or you're funding us to do it. It has to be one or the other, because otherwise people end up in hospital because they become immobile, and it's
about
basic prevention. Yeah, exactly.
Absolutely.
So I mean, I'll be going back to River because the CCG has funded it, but obviously if it's a council thing, hopefully he can put me in touch with the people. But we know Hackney Social Services does not have money, so there is an issue there. I mean, that they are not a rich council at the moment. But we're also not talking massive money. It's the current contract with the CCG is like £16,000. It's not 200,000 or something. And so I do know the sort of sums that. So it would seem like a very silly cut. Well, not cut, but a very to not allocate the money to this from somewhere. It does feel counterintuitive, because it will end up costing more money further down the track, won't it, if you're leaving vulnerable older people without this service. So yeah, I will be trying to make that case, but if Healthwatch can help, that would be great. So,
again, definitely we'll have that conversation with you hopefully soon.
Yeah,
and see how we can perhaps work together. But thank you very much. That's amazing, and hopefully it will make a difference, really. Well, any questions for Jackie or for Chapa? I can't see any raised hands. No. Well, then I guess I'll have to thank you all for your time today. The speakers, Chaba and Jackie, really grateful for your time and the information you provided. We will upload the video on our YouTube channel, and I will send the link to you once this is done, so you can watch it later on or pass it on to anyone else interested. I would like to invite you all to our annual general meeting tomorrow. It will be on Zoom, and I will, I believe I sent you the details for the meeting, but I will make sure that I send this to you again at the end of this meeting. Please feel free to join us and hear what we did last year. The meeting is on Zoom, and it will be between 4 p.m. and 5:30 p.m., Catherine, or 6 p.m. An hour
6 Canarian 6.
Yes, sorry, thank you, Leah. Between 4 p.m. and 6 p.m. Diane Abbott will be joining us for discussion around the redevelopment of St. Leonard's Hospital. Please join in, have your say, and tell us your ideas of how you want to see St. Leonard's operating and look like. Well, yes, thank you very much then. I hope you have a good...
Could I use the same phone number to join in tomorrow? Because I'll be asking.
Absolutely, you can. And I will make sure I call you at the end of this meeting to give